welcome to the infusion therapy room. So I had a close look, even though some of you were struggling, no one fell asleep. So that's already a good sign. I hope this is also an interesting topic for your customers. These resistances are not only risk for the patient, but also the healthcare worker. They increase costs for the whole system, and this is a good starting point for our discussion.
Finally, after 5 years on dialysis, a suitable donor became available. Robert underwent the surgery successfully and is now in ICU for approximately 9 days. In order to assess his fluid balance and cardiac output, Robert needs an intra-arterial blood pressure measurement as well as an enteral and parenteral nutrition therapy. This also includes a close monitoring of his electrolytes, glucose and lactate values with the help of a blood gas analyzer. Due to his chronic kidney disease, Robert is prone for infections and therefore needs the infection prophylaxis, which is an essential part of the anti-infective therapy. So, the basic goal is to improve his perfusion and thus the oxygen supply of his kidneys. So I would like to welcome you to follow me through Robert's anti-infective therapy from the prescription to the discharge. Carsten, what would you recommend in Robert's case as being the appropriate solution?
Nicolina, thank you. After the kidney transplantation, healthcare professionals could observe infections in Robert's abdominal area. It's indicated for such infections, such as lung and pleural infections, which you often observe after kidney transplantation.
Yeah, in general, infusion solutions belong to the most commonly prescribed medications. This is of course also true for our patient Robert. During and after transplantation, fluid therapy is a supportive therapy to achieve hemodynamic stabilization, which is crucial for Robert. The replacement should be done by a crystalloid solution to avoid negative effects on the kidney. And for our patient, we would recommend sterofundin iso, our balanced full electrolyte solution added by potassium, magnesium, phosphate due to the respective need of Robert. Sterofundin iso has an other beneficial effect, as these patients often tend to be acidotic and the solution has a slightly alkalizing effect.
So as a result of Robert's chronic kidney disease, he already has a CBC in place beside an arterial and peripheral access. But can we just use standard patient access products, or do we have to keep their specific recommendations in mind? Tore, what's Bibron expertise in this field?
In this case, I would recommend something special. This not only improves the handling procedure, it as well reduces the time and money, and it decreases the amount of waste. And then to manage the infection afterwards, so during the whole indwelling time, I would recommend to use an antimicrobial catheter called Certofix Protect. And now is the question, how many lumens do we need? Because 3 of those fluids have to be administered centrally. So we would get over the medial channel parental nutrition, like Nutriflex Lipid, and we would use the distal channel to administer fluids like sterofundin iso, and over the proximal channel. What was this again?
Catecholamines for controlling the blood pressure.
Thank you very much for sharing expertise.
Very welcome.
So in the next phase, the preparation of drugs and infusion solutions, healthcare workers are faced with significant risks to medication errors, which requires the highest focus on the process. Pascal, how can risks occur in the preparation phase? I thought there are only guidelines in place like color coding, avoiding these kind of medication errors. So what can we do?
International studies show us that still 1/3 of medication errors are caused by confusion over packaging and labeling design. If we think about our patient Robert, if he gets a wrong dose of potassium chloride, for example, this will very likely kill him. But also a mix-up of the other drugs and solution might have severe consequences. That's why B. Braun offers a very intuitive packaging and labeling concept for pharmaceuticals, which clearly differentiates the type of solution and the strength. It follows many international guidelines and recommendations on safety labeling. And if we compare the today's or the current existing concept to the new one, This one definitely makes the process of drug preparation much more efficient and, in the end, safer for our patients.
The drug application is a crucial and sensitive step in the anti-infective therapy and requires also here a high intention, and Bibron can offer here a very good solution. Maria will now explain us the advantages of our system to reduce medication and dosage errors and to help here also to work on a very safe and closed system, perfectly configured manner.
With its accurate flow rate, the space system offers a constant drug delivery to Robert, who receives inotropes, electrolytes, antibiotics, nutrition, and insulin. Because Robert also receives the light-sensitive drug furosemide, we also offer the light-protected portfolio. By the way, we also did a redesign of the complete OPS portfolio. With this new design, we optimized the startup characteristics for the syringes. The startup characteristic is essential for drugs, especially for noradrenaline, when running with small flow rates.
Yes, so we do have a solution from Bree Brown as well. But before I explain the solution, maybe it is important to know that our patient Robert here receives also immunosuppressant and corticosteroids because of his kidney transplantation. So he has these medications lead already to hyperglycemia, which he is suffering. And to get his glucose level and target, Bree Brown developed this little green thing over here, which is the sensor technology. And it is an inline arterial sensor who measures the blood glucose level.
Sebastian, is there still a high risk of medication and dosage errors, even on the intermediate care unit?
For sure, Nicolina. To infuse smaller doses of electrolytes with high accuracy and metronidazole in a predefined time, Compact Plus is the first choice for Robert. And its integrated dose error reduction system, B. Brown offers a smart, safe, and easy-to-use solution.
He's still on antibiotics in order to avoid transplant-related infections. So treating Robert now in general ward should be super easy, isn't it, Stefan?
Actually, it's not so easy, Nicolina. Since antibiotic treatment on the general ward is still necessary to recover, and it bears also some risk for the clinicians. To reduce the risk related to the anti-infective therapy, we have developed a new antibiotic set. The features of this antibiotic set is that you can flush the line in a closed system. Finally, we will also reduce the risk of antibiotic resistance.
With Easy Pump 2, Robert can recover in the comfort of his own home. He doesn't have to stay in hospital any longer.